It's Sunday, June the 28th, 2020. A GP in private practice called me this morning to tell me that in the last 24 hours, he's received 20 positive results for his patients. Another GP, whose practice can't be more than 10 kilometers away from this one, had 17 cases in the last 24 hours. Hospitals across Gauteng are on divert, and we all know people who are not only ill, but who are seriously ill. If, like many of you have told us, you consider these podcasts to be fear-mongering, then I invite you not to watch them. The goal is to inform and to educate. If that frightens you, well, you are simply human. Because indeed, we are living in scary times. Good morning. I'm Howard Feldman. This is the Synthesis Sunday podcast with Dr. Anton Meyberg. Last week's podcast received more than 11,000 organic views. We have received hundreds of questions, and I apologize in advance if yours is not answered. We will do our best to provide as much information as possible. Dr. Anton Meyberg is a close friend, which means I see firsthand the strain, the stress, and the pressure that he endures. The last week has been significant. Good morning, Dr. Meyberg. Before we begin, how are you doing?
Good morning, everybody, and thank you for that. Yes, we're definitely going through tough times at the moment. It's very stressful. There's a lot of anxiety at the moment. And I'd firstly like to thank my wife, who's my rock and my pillar and my support through this time, who's been supporting me in the background, and my family and my children who are sharing me with the community. So thanks to them, and let's hopefully fight this battle and win this war.
Okay.
We're currently sitting on 10 million cases worldwide with 501,000 deaths and 5.4 million cases recovered. The United States has hit 2.5 million cases with 128,000 deaths. South Africa is up to 131,800 cases with 2,413 deaths and 7,210 new cases in the last 24 hours. Currently, there are 1,158 patients in hospital in Gauteng, with 207 of them in ICU, and about 3,675 patients in hospital throughout the country. Regarding fear-mongering, which is a very important point, but I'd like to allude to a certain other biblical character called Noah, who built an ark over 120 years. People looked at him, said he was a fear-mongerer, said he was doing wrong things. We've been building our ark for the last 4 to 5 months. Albeit we're not taking 2 of every animal onto this ark, we are trying to fit every single person we can onto this ark. We've been building an ark, we've been strengthening the ark, and we are now ready to attack this flood. So if you're with us, you can join us on this ark and hopefully not stand on the side and get overtaken by the tide.
So how are the hospitals coping? Because we're starting to hear about hospitals on divert. We're getting mixed reports that a lot of our public health facilities are filling up. What is the situation on the ground, and what are you seeing?
So this is what we expected. The hospitals are filling up dramatically. Most of the hospitals in Gauteng are going on divert for a number of hours a day, going off divert, going back on divert. And that means they are full to capacity with the number of patients they can handle, and also the number of staff members that are there to treat the patients. You can't just fill up hospital beds and expect no one to treat the patients. Unfortunately, we are in a pandemic, and not only are patients going to get sick, but doctors are going to get sick, healthcare workers are going to get sick, and more importantly, nurses are going to get sick. And if our nurses get sick, that is where the trouble comes around, because we need the nurses to help us look after the patients. The nurses are the most critical, crucial part of our armamentarium against this war. So at this point in time, our hospitals are very full. But the whole point of the lockdown was to get us to the stage so we would be able to fight at this point. And we are fighting, and we are winning the battle on many fronts at this point in time, because we are ready with all the knowledge and we are ready with all the tools that we can fight with. We've got our PPE at this point in time. We've got our medications that we can fight with. And hopefully that will be what will take us through the next few months.
Okay, so hospitals are full. What are you seeing in terms of age? of patients. We've obviously been told that older people are a lot more vulnerable, yet a lot of people that I know, people of, I would say between 40 and 55 or 60, are also becoming seriously ill with COVID. Are you seeing any trend in terms of ages?
So the median age is around 54 to 55. We're seeing a large majority of those patients coming in, but just understand that those patients that are coming in at that age have got comorbidities. And it's generally someone with more than one comorbidity. In other words, more than hypertension, more than diabetes. They've got multiple comorbidities at the same time. So, but I'd say around about between the 50s to the 60s are our biggest age group at this point in time. Those people that are coming to hospital doesn't mean that they are all critically ill. They are ill, but a lot of them are being discharged.
Okay, so that is good news. A few people have asked on Facebook and through various means about sleep apnea. Is that considered a comorbidity?
Sleep apnea is not a comorbidity, but generally people who are obese or overweight have a higher comorbidity towards getting the virus and getting sicker with the virus. And a lot of people with sleep apnea are overweight. So there is a causal link, but it's not sleep apnea itself, which is the problem.
Right. So if a person has sleep apnea, they shouldn't worry about that as a factor.
No, that's not a risk factor.
Lots and lots of questions about who to quarantine, how long to isolate, and there's a tremendous amount of confusion around that. If I come into contact with somebody who's COVID positive or someone who's gone for a test, can you just take us through that again, please?
Right. So if you come into contact with somebody who's COVID positive, you need to isolate yourself for 14 days. Isolating yourself for 14 days means you need to stay in a separate room in the house, away from the family, not interacting with them, not using the same plates as them, using paper plates, paper cups, using your own bathroom, and staying completely isolated from their family. Unfortunately, that is not always a practical thing to do. People have got young kids, people have got other family members, they cannot isolate themselves. In that case, then you need to quarantine the whole family at home and quarantine together. Obviously, as I say, it's ideal to isolate by yourself, but it's not always a practical thing to do. So then you quarantine for 14 days. There's lots of rumors of people talking about only quarantining for 7 days and going for a test. It only is applicable in healthcare workers, the quarantine for 7 to 8 days and going for a test, because of the paucity and the lack of healthcare workers available to treat patients. And generally, healthcare workers are wearing full PPE when they treat patients. So if they come into contact with a patient who's positive and didn't have the required interventions between them, then they quarantine for 7 days, test on the 8th day, and then go back to work. But the rest of people who are not wearing full PPE need to quarantine for 14 days, no exceptions. And there's no point in retesting at the end of the 14 days because we don't have enough tests. And if you are positive, the test can stay positive for further 2 to 6 weeks thereafter. That doesn't mean that you are shedding a virus, but it does mean it's still a positive test.
So I want to ask you Tammy's question around this because it's she puts it in a very interesting way. She says, he said last week that if a person gets tested positive, it can stay in isolation for 14 days with the family and not necessarily there's no real value for the family to be tested. My question is, so then the person tested positive, it's their day one. Let's say the dad, and they isolate for 14 days. But what happens if a family member, let's say mom, also gets it, but only on day 5 days later of those 14 days? Once dad is 14 days, his 14 days are up, mom is also finished her isolation. Wouldn't the wife still be positive and then spread the virus?
No, excellent question. So, and that's the whole point why we say rather isolate one person only and not the whole family. But unfortunately, it's not possible. So if you have quarantine altogether and dad is positive and then mom gets a positive result or gets symptoms on day 5 and then a positive result, her quarantine starts only then again on day 5 when she got symptoms, and the whole family has to stay in quarantine for a further 2 weeks. It's dramatic, it's terrible, but that's the only way we can curb this virus spread.
If you've come into contact with somebody, let's say 5 days ago, and they become symptomatic and they go for a test, but they haven't got a result, so they are not COVID, they're not confirmed positive, are you obligated or should you then be in isolation until they have received their results, or is that just too much of a disconnect?
So it's quite an open-winded question, but they're saying, and it's the point is, when you've come into contact with the person, were they symptomatic? It's a very important question because it's generally within the
Okay.
last 72 hours that they'll be more prone to spread the virus, even if they're asymptomatic, etc. Okay, but the right thing to do if you find that someone's positive and you haven't worn your mask and you haven't obeyed the laws of the actual distancing, washing hands, mask wearing, then you do have to isolate yourself or quarantine yourself at least for 14 days because there is a possible exposure there and you don't want to have the risk. Look, we don't want the stigma of COVID going on everybody. We know that. And the only way to stop the stigma is to look after ourselves, to come out, say you are positive so other people know and they can protect themselves and protect other people.
Mm. And Aviva wants to know, how do you know if what you're experiencing or someone in your family is experiencing is just normal winter symptoms, running nose, maybe because of the cold, a bit of a flu?
Well, Aviva, that's a fantastic question. And the chances of you knowing are very minimal at this point in time. We're going now, it's getting very cold. The winter's here. We're going to see other viruses. The important thing to do is be in contact with your healthcare worker, with your GP or your specialist who knows your family and knows your systems and can advise you further. If you are very worried and you discuss with them, they might say to quarantine, and if you become symptomatic, then they will say to test. But not every single person in the family needs to test. Once one person is positive, you can quarantine the whole family at home. You don't have to test everybody. We are running out of tests at this point in time. And if you look, there's a big disparity between the numbers between Gauteng and Western Cape. So in Gauteng, the numbers are over 30,000, in Western Cape over 50,000, but the numbers aren't shooting up dramatically in Western Cape. And why is that? That's because they're not testing enough people in the Western Cape because they don't have enough testing kits. So they're only testing people in the Western Cape who are over the age of 65 with comorbidities, healthcare workers, and people who are in hospital, but they're not testing the rest of the population. So our numbers are going to be far higher. And it's not the government hiding numbers. It's the fact that we are not testing because we don't have the abilities to test. We don't have the agents to test. This is going to start happening in Gauteng soon as well. The numbers are ramping up dramatically, and we're going to have to stop testing every single person so we can save it for the people who are extremely ill.
Yesterday, we had 7,210 new cases across the country. When do you think we are going to peak? These numbers are very frightening.
So at the beginning, we thought our peak would be in August, and then we thought the peak would be at the end of July. I think our peak's coming in the next week. We are peaking now. We are hitting huge numbers. We are going to peak in the next week to 10 days, and there's no doubt about it. And the sooner the peak comes, the better for all of us. Because once the peak's there, we've sustained and gotten over the peak. Hopefully we can stop the plateau and go downwards, and then hopefully people can start getting better, and hopefully we can avoid a second wave.
Can you explain the second wave thing? Because to me, all it seems, now following it overseas, of course, it just seems to me that the numbers went down, and then as people become less careful, so it increases again. Is there a need or a reason or a value in calling it a first and second wave?
Well, there is, because certain countries say that they've completely eradicated the virus, they've treated the virus, and they've got no more people having symptoms and no more people being reported as positive. Then what people do is they go back into full bravado. They go have 5,000 people in a protest, or they go 5,000 people at a sing-a-song or sing-along, and there you have it. People are exposed, and there your second wave comes about. So the second wave is not a real second wave, but it's a wave of continuation of the virus that we are seeing overseas. It's happening in Israel. It's happening in America. The numbers are ramping up in the United States because people have believed that they are infallible and they don't need to wear masks. They go to protests. They go to all types of events. No one is doing their social distancing. No one is wearing masks, and they're being hit very hard again in America.
A few people have sent us the question asking about immunity in terms of if you've had the virus, can you get it again? I heard about a case of a doctor who apparently did get it twice. Now there's, but unclear as to whether the first test was positive because the first time he wasn't symptomatic. It's very confusing. Does the medical fraternity know?
So we absolutely know absolutely nothing. We have no idea. But we understand what is going on, okay? So you can get a false positive result. We do know that. However, every test that comes back positive, you have to take that as a positive result and quarantine the person. Thereafter, if a person gets sick again and they're extremely ill, it is most likely that it was a false positive result if it's a number of weeks later. Regarding immunity, everyone thinks that if they get the virus, they're going to be immune. We don't know that yet. We're still waiting for the antibody test to come into the country. We need a very sensitive antibody test. We need a very specific antibody test because we need to know the person has got antibodies against that virus. It's too new a virus for us to know how long you'll have immunity for. We don't know if it'll be for 2 months or 3 months, 6 months. We have no idea yet. And without a vaccination, we still don't know anything further regarding that. So just because you've had the virus, you don't have an immunity passport to go out into the open and consider yourself to be absolutely safe from coronavirus and that you won't get affected again. You still have to take care of yourself and look after yourself. Another thing which could also be worrying, which we still don't know yet, is that if you have had the virus and you go for an antibody test, depending on the antibody test, it could show you immune, but we don't know how many of these tests are showing immunity to the other coronavirus, the non-COVID-19 coronavirus, and you've got to be very careful of these things.
Right. Is there a reason that we don't have this test in the country yet? Surely by now we should have this.
It's coming into the country very soon. They're doing tests on it. That's got to be ratified by the Medical Control Council, the NRCD, and all the other laboratories who are using it. And once they're happy with the fact that they can read the results properly, it will be in the country. I know that the SANBS, South African National Blood Service, who are doing tests for convalescent plasma, have already started using the test on patients who are positive to good effect, but it hasn't been rolled out yet.
Earlier this week, or actually late last week, I spoke to Hadassah Hospital in Israel. They're testing something called a passive vaccine. Can you just tell us a little bit about that?
So that works on the immunoglobulin G, okay? And that's not the same as a normal vaccine. It's very similar to the convalescent plasma type of vaccine. That's basically given to people from people who were positive. They've taken their antibodies and they instill them in people who are extremely ill. So it helps in people who have been on oxygen, on ventilators, who have had multiple other treatments, and helps them fight the virus, giving them antibodies and hopefully making them better.
Mm. In terms of prevention, you are a number of people asking us about the vitamins. Can you just give us again, and I know we go through this every week, but it's really important, just to give us a sense of what we should be taking and how much we should be taking of these medicines and the vitamins, and should we be giving them to our children?
So every adult and child should be taking vitamins at this point in time. You know, we used to hold the adage that you don't have to take vitamins. We're all very well nourished. And all the vitamins you take, you'll basically urinate out anyways if you don't need them. We're in a different situation now. You need to boost your vitamins now. We're going into winter. You need to boost your zinc, your vitamin C, your vitamin D, your thiamine, your nicotinamide, all of those types of vitamins. From that point of view, you can get a good multivitamin if you're well, that has got all of those things, and take that on a daily basis. If you are sick, then we can go into the actual dosages of the medications you need. But if you are well, just take a general multivitamin with zinc, vitamin C, vitamin D, thiamine, nicotinamide. Those are the most important ones to protect you throughout this time.
And you can take the normal dose. You don't need to increase the doses.
Take a normal dose at this point in time, and that's what you need to do. Don't increase the doses. Only increase the doses if you're actually ill.
Okay, and in terms of our children, they should be taking vitamins as well, but one designed
Definitely.
appropriate for
children.
their age group.
Correct.
Right. Okay, so getting to more questions, because so many, and a lot of people asking about schools. We've certainly seen many breakouts in certain classes, at schools, a lot of schools around, certainly in the Eastern Cape, closing. What is your view? You've been a huge proponent of kids going to school. Do you still believe that that is the right decision? Because a lot of questions are worrying about that.
So I think you've got to look at the schools individually. Have the schools got the right understanding of the virus? Are they protecting people about looking after themselves with the virus? Are they social distancing? Are they giving PPE? Are they giving masks? And are they keeping classrooms in a bubble that if someone does have an infection, they can close their classroom for 24 hours? The biggest problem with the schools is if there is inter-child spread. So far, what we have seen has not been inter-child spread, it's been spread from adults to children, not spread from children in the classroom. If there are multiple children in the classroom that are spreading it to each other, that's a completely different story. Then you have to close the schools down. I still believe that eventually we are going to close the schools, but at this point in time, I don't believe that it's necessary to close the schools because we are managing it very well. There are isolated cases, 1 or 2 cases of children that do have the virus that have picked it up from their families. Those children are in a bubble. in the classroom. They can close the classroom down. The children are socially distanced from each other, publicly distanced. They're wearing masks. They're doing their hand hygiene. And then they're not affected. The children are not the super spreaders. So at this point in time, where we're at now, it is still safe. Once again, if you keep your children at school, you're keeping them in a safe environment. Once you keep them at home, there's going to be play dates, there's going to be interaction with other children. It's far less safe for them at that point in time. But as I say, we're now going to be hitting our peak. We'll have to see in the next week to 2 to 3 weeks what's going on with that and how the spread is to decide where to go with the schools. So it's still open for debate.
But you are still sending your children to school?
I'm still sending my children to school.
Andrew says, we're hearing of so many people who have taken incredible measures, social distancing, masks, hand sanitizing, etc., but still have COVID-19. How do some people dodge the bullet? Before you answer that, I want to tell you the second part of the conversation that I had with the doctor, the GP this morning, where he said he's got 20 cases in the last 24 hours. He said to me that each one of these 20 people knew exactly where they got this from. And in almost every single case, it was a case of somebody not being careful in terms of social distancing and masks. Your view, Anton Meyberg.
So I think that's correct, because people think that they're being careful and they think that they're washing their hands and wearing the masks. But if you actually go into the history and you speak to them properly, they do admit, well, actually, I did take my mask down when we sat down for coffee and we drank the coffee together. Or I didn't wash my hands as carefully. Or we were quite close to each other and the mask did come down because we had to breathe. So people are more prone to get the virus, even if they are doing the hand washing, even if they are doing the mask, but it's because they're not doing it properly. If you are doing it properly, you decrease the risk dramatically. You know, we've asked for people to stay at home, for people to just keep their distances from people. Obviously, you've got to go to work and obviously you've got to go to the shops, but you've got to be very careful. If you go to the shops, wash your hands multiple times, use your hand sanitizers, keep your mask on the whole time. Don't put your hands on your mask and keep on touching your mask. Put your mask on from the side, take it off from the side.
Very bad at that.
Change your mask every single day. Wash the mask in hot water and put it outside to dry. Don't put your mask in the microwave at this point in time. However, there are studies coming out that you can put N95 masks in a microwave in a certain way. Those are still being done and those are coming out soon, and hopefully that can help with the use of masks at present. But there's a lot of other hypotheses saying that depending on your blood type, or depending on this, or depending on your comorbidities, you'll get sick, etc. You've got to look after yourself. You've got to take the responsibility of wearing your mask all the time. And I must say, I went for a run this morning, and kudos to everybody, because the majority of people this morning were wearing masks. This is the way we protect each other. This is the way we are not being selfish. This is the way we look after each other.
Lawrence asking the question, and it's kind of what we alluded to before, but I like the way he put it. He says, since Dr. Meyberg suggests that people should not get tested if they're showing mild symptoms, but should just self-isolate, when do they know if they can come out of isolation?
Very good question. So it's a rule of 10 plus 3. So this is very important, especially if you want to go back to work, etc. So let's say you are positive, for instance, and then you're in isolation. Then we count for 10 days. And if you've got no symptoms after 10 days, i.e. that you're not taking any medicine to bring your fever down, you're not coughing, you're not short of breath, then we count a further 72 hours to actually make it another 4 days after that 72 hours. Now there's 14 days. If you've got no symptoms in those 72 hours, then on day 14, you can go back to work without a test. If you are still symptomatic on day 13, then on day 14, if you've got no symptoms, you start your 72-hour counting period from then. As long as you've got 72 hours of no symptoms after that period, then you can go back to work, or then you can go back into society and you don't have to retest.
Audrey wants to know, is there any research being done into the smallpox vaccine as a contribution to factors in the South African population?
Not relevant at this point in time. No. It might be, but it's not relevant.
And BCG probably as well.
Not as relevant as we thought it was initially.
Well, very clearly, if we look at our numbers, we are heading towards being one of the most infected countries in the world at the moment.
Yeah, and we're going in a dramatic peak. And as I said, we are peaking. So we're in the top 20 in the world, you know, which is dramatic.
A lot of questions about domestic domestic workers. Let's just go through that. A few people asking, live-in domestic help, obviously not a problem, especially if people have
well, hold on.
isolated.
Living domestic work is not a problem if your domestic worker is staying at home. If they're going out every day and going to the shops, you just got to educate. It's all about education. Wash your hands, hand hygiene, wear your mask all the time, and then it won't be a problem. The problem comes is when you've got somebody who's not living and they are taking
or somebody who wants to go home, to see their own family because they haven't seen their families in a while because of isolation. If they're going home to a family in a private vehicle, what's your thought about that?
You're still got to be very careful because, first of all, are they wearing the mask the whole time in the private vehicle? Is the person in the private vehicle wearing the mask? And when they get home, how many people are in the house? How many people are involved? How many people are sick? It's a very dangerous thing to do. And it's not looking after yourself or your domestic worker by sending them home and then bringing them back. If you do bring them back, they have to come back into isolation for 2 weeks for their own selves and for your own selves. And it's the whole thing again of charge. Should you be bringing charge at this point in time? I know we're on level 3 and probably going to level 2 soon, which I can't understand, but I do understand from an economic point of view. It doesn't give us a license to bring chars in at this point in time who are not living, who are traveling in multiple forms of transport, who are associated with lots of other people. It's too dangerous.
So you are still of the view that if somebody has a domestic worker who's a live-in domestic worker, that's okay, provided obviously everybody's educated in the same way the family's educated. But the minute the person goes home, that needs to be looked at differently.
And you've got to remember, your domestic worker is part of your family. So they can come in the house, they can not wear a mask, they can be part of your family. It's exactly the same as having your children or your wife in your house. They are part of your family. So there has to be no difference in the way things are treated there.
So just looking at one of the questions, so you would say that a domestic worker who's live out and is catching a taxi in every day to work is pretty much a no-no?
No. Correct.
Right. Okay, because lots and lots of questions around that. Lauren says, when will this end?
Lauren, I'll let you know. I'll be the first one to phone you. Just send me your number.
Right.
I'll
Lauren,
put you on speed dial.
Right. Just so you know, we were trying to work out this morning what number podcast this is. And Anton said to me, what number is it? And I said, I genuinely have no idea. I think we must be on number 17. This is probably the 17th or 16th Sunday, at least in a row, that we've been doing this. Who would have thought that this would have been 17 Sundays in a row? Started off in studio where we could be in the same environment. Then we moved to isolation. Then often you do this from your office or from the hospital. It's just insane.
Yeah.
And still, I think, if we think about it.
I think with that, that's very important what you say. But I think with that, with all this doom and gloom, I think it's time for some good news. And it's time for our good news segment of the podcast. There is fantastic news at the moment. There is no better news than almost a cure. No. This is far better. You can't.
Is it going to involve hair dryers up your nose?
Second best to that.
Okay.
The best news at the moment is that Liverpool are the champions of England. Liverpool are the champions of Europe. And Liverpool are the champions of the world. And whoever didn't believe in our favorite unicorns, now is the time, because Liverpool are champions after 30 years. And so to quote, when you walk through a storm, hold your head up high and don't be afraid of the dark. At the end of the storm is a golden sky and the sweet silver song of a lark. Walk on through the wind. Walk on through the rain. You will never walk alone. We will all walk through this together. We are all here together. We are all going to look after each other. We are all going through this as a community, as a society, as a species. Protect yourselves, protect each other, and be safe.
All right. So with that, we've just probably lost around about half of our listeners, but it's okay. The amazing thing is, of course, You'll Never Walk Alone. It might be the Liverpool anthem, but it certainly is the most beautiful words and melody. And it actually really does capture so much of the time that we are living in. If we can keep doing this and we can keep educating you, we will try and make sure that, of course, you never do walk alone. I'm Howard Feldman. This is your Synthesis Sunday podcast with Dr. Anton Meyberg. We do this every week. Keep your questions coming. We try as much as we can to answer as many of them as we can. Keep safe, keep healthy, look after yourselves, look after each other, and wash your hands.